So real quick, guys, patient has TB. What happened?
She said that his name Diego.
Yeah.
That's her son's name.
Papa, what changing your name? His middle name is Royce. That's after Royce the 5'9", the rapper. No? Okay. TB, guys. Patient has TB. What type of isolation are we going to put him or her on?
Reverse isolation.
Okay. No, not reverse isolation. Negative pressure, yeah. That's just for you guys to know. Okay, I'm not going to test you on negative pressure and things like that, but I want you guys to understand the concept. You don't want anything that, if a patient's immunocompromised, you don't want anything that's outside getting in. So you're going to keep blowing everything out. So that's positive air room, all right? Anyway, positive pressure. If a patient has TB, they're on a droplet precaution, okay, meaning we have to put a specialized mask on them or a mask on them. What happens if we have to take them, like, let's say, a lot of the times the patients can leave their room, okay, for whatever reason, maybe because they have a diagnostic test that they can't necessarily come and do at the bedside. How do we protect the people from point A to point B from the patient? Yeah, what did you say? You put a mask on them. Yeah, you put a mask on the patient, right? You put gloves and gown and all that stuff on them? I don't know what that is. Yeah. So essentially, yeah, you put a mask on the patient in case he sneezes, coughs, whatever. It's actually going into the mask, and he's not infecting anybody else. Are the nurses going to put masks on?
No.
It's not necessary. If I were you guys, yeah, I probably would. It's not necessary, okay? When a patient has tuberculosis, what are the two main medications that we use? Rifampin, right? And what else? What's INH stand for? Sonicide. Okay. How many medications do we use typically to treat tuberculosis?
3 to 4.
We use 3 or 4, right? The more the better, though. Okay, 3 or 4, but the more the better. So so what's the best answer? Yeah, 4, right? 3 to 4. We always have a therapeutic range. Right? It's like if I say, which blood pressure is worse, like 199 over 100 or 201 over 200. Well, they're both horrible, but 201 is slightly higher, so that one's a little worse, right? Does that make sense? Okay. What's the best way to prevent the most common complication of TB, which is pneumonia? How do you prevent pneumonia? Try not to look at your books right now. Just really think about it. How do you prevent pneumonia?
By treating TB or
Ambulation, that's good. Yeah, ambulation. What's happening with pneumonia? What's pneumonia? What's if Diego, explain to my son what pneumonia is. Papa, what's pneumonia? What's pneumonia? Say, I don't know.
I don't know.
So what's pneumonia? The little kid doesn't know anything. What are you going to tell somebody that has no clue of what pneumonia is? What are you going to start off by saying? Don't think too hard, guys. Oh, no, I'm asking you what pneumonia is right now. That's right, but
Pneumonia is bacterial.
bacterial or viral infection, right, of the lungs, of the fluid in the lungs. It can be, someone said ambulation, right? So if you ambulate, therefore that fluid doesn't settle. Okay? If you cough and deep breathe, that fluid doesn't settle. So you can prevent those things. Yeah, washing your hands is one of the most common ways to fight off the infection. What if you have viral pneumonia? Can you treat it with antibiotics? No. What are you going to treat it with? Yeah, palliative or antiviral medication. Good. If a patient has any type of respiratory, any type of disease, if the body is actively fighting off infection, whether it's pneumonia, whatever it is, do we encourage fluids? Yes. What if it's pneumonia? Do you encourage fluids?
No.
You do encourage fluids. Yeah, you do encourage fluids. Remember, we had a little question like this last week. You want to make sure you encourage fluids. Papa, can you do that on the floor, please? Can you do that on the floor? Go ahead, go on the floor. Thank you. Yeah, you want to promote fluids, but you don't give too many. Like, you don't want to give, like, if a patient has pulmonary edema, you don't want to give copious amounts, or you don't want to give, like, 4 to 5 liters. You want to increase fluids, keep the patient hydrated, but you don't want to give them copious amounts. Does that make sense? Okay. If a patient has pneumonia, What lab work are we going to be looking at?
CBC.
Okay, X-rays. What else? CBC. Good. What else? Again, pneumonia is the lungs, right? So is this going to affect the patient's breathing? So when we diagnostic tests will give us a better reading than a better reading than an SpO2 monitor. What type of a diagnostic test will give us a better reading? You guys remember? That was also one of the again, guys. If a patient has pneumonia, and you
The respirations.
okay, that's good. But I'm talking about diagnostic tests, lab tests. Which one? Which blood test? Aside from the CBC. Huh? No, aside from the CBC, that's included in the CBC. But yeah, it's no, it's gonna be ABGs, guys. You guys remember that? It's right there, right? Oh, yeah, arterial blood gas is because it'll also let you know how well the patient is ventilating at a cellular level, like looking at the cells, looking at the blood. Excuse me. A lot of the times, if you guys ever see a patient having diagnostic tests, they'll sometimes have a UA as well, a urinalysis. The reason why the urinalysis is sometimes ordered for any type of infection is to rule out a UTI. So the patient has like elevated WBCs, you also sometimes give a UA. But for the exam, that's not going to be the consideration, okay? Understand that the best two tests for assessing the pneumonia status is going to be your CBC and your white blood cell count. But I have heard people in like NCLEX setting questions that they ask you, oh, it's a UA. Understand that's why it's there. Okay, just understand that's why it's there. But for pneumonia, it's going to be CBC, ABG. Because those strictly deal with breathing issues and potential infection. Anytime a patient has any type of sedation, like for a bronchoscopy or anything like that, before you introduce PO elements, what are you going to assess? Always assess gag reflex. If a patient is, let me see. If a patient's not breathing, okay, is their CO2 going up or down? Think about this one, okay? It's going up. That's right. The CO. And let me explain this. Essentially, when we breathe, right now, as we breathe up and down, like one breath, and then breathe again, okay, it's maintaining our CO2 levels normal, okay? The things that assess that are the chemoreceptors that are found in our carotids and our aorta. Anyway, if we breathe too fast, we're blowing off CO2. So what's going to happen to the CO2 in our body? It's going to go down. Okay. If we keep blowing it off, if we keep breathing fast, it's going to be. Now, what if we're not breathing? Again, it's going to go up. If you guys take a deep breath and you just hold it, the CO2 levels start building up inside your body. Like the CO2 that you have in there already starts building up and getting bigger. So if somebody has respiratory failure, what's going to happen to their CO2? Yeah, the level's going to go up. What if somebody has emphysema? What's going to happen to the CO2 levels? It's going to go up because they're not breathing well. They're not exchanging that. Okay, does that make sense?
Look, Papa.
Good job. What do you guys know about a pneumothorax? Lung collapse. Okay, lung collapse due to air pressure gas building up inside. Right on the board. Okay, Papa? Yeah. Okay, right on the board if you want. Pneumothorax. So what are some complications of a pneumothorax? Okay. Dyspnea, shortness of breath, okay. What's happening to that lung? It's collapsing, right? It's going to go to, well, now answer me this. Yeah. If my left side if my right side is affected, what does that mean? Listen. That's right. So if my right side is affected, this is a scenario, my right side is affected. When I auscultate, what am I expected to find?
On the left side.
What,
Not by anything.
what was that?
You said if it's, that's the one that's affected?
Yes, if my right side's affected, when you're auscultating,
You're not gonna hear anything.
exactly, on the affected or the unaffected side?
Unaffected.
On the affected side. Now, again, my right side is the affected, it's collapsed. When pressure builds up and you get that tracheal deviation and that pressure, is everything going to shift towards the affected or the unaffected side? Unaffected side. Unaffected because there's this gap in here, right? The air, the lung has collapsed. Air's pressuring now. Now it's pushing towards the unaffected side. This is the side that's not affected. Make sense? Cool. What's the goal in treatment of a pneumothorax? Aside from or maintaining respiration, what's the goal?
Is to get that lung back.
To get the lung back expanded, right? Okay. To expand the lung. How can we get that lung to expand again?
With the tube.
The tubes. What's that? The tubes called? The what? Yeah, but the two tubes. What's that called? A chest tube, guys. It's a chest tube. Yeah, the chest tubes. Okay, so now we're talking about chest tubes. When it comes to chest tubes, how many tubes do we have, Ms. Gitali?
2.
Okay, where and where?
Proximal and anterior.
Okay. Refine those words again. Which two tubes do we have?
Proximal.
Not proximal.
Anterior.
Posterior and anterior. Remember, the patient's going to be one back here, one in here, one right here, right? What's the anterior tube collecting? Air. What's the posterior tube collecting? Drainage, fluid, purulent drainage. It could be blood. It just depends. What's all that drainage going into? No. The basket thing. But you guys know, a bag, the basket thing, the chest tube box, right? The drainage system, the underwater sealed drainage system. Papa, don't be so loud, okay? So, how many chambers does it have, typically? Okay. Typically it has 3. I see what you're saying. We have 2 extra chambers in case so much fluid comes out, it'll spill into the other one. Essentially, there's 3 main functions of each chamber. The first chamber, it's the drainage. Then we have a water sealed chamber, and then we have a suction water chamber. My question to you is, which of those is not supposed to be bubbling or anything like that, or fluctuating?
The suction you
No,
hear
the
about.
third chamber.
The middle one. The middle one, that's right. That's right, the middle one, the one that's sealed. The sealed chamber is the one that's supposed to, the airlocked one. That one's not supposed to be moving at all. If it is bubbling, Salud, Papa. If the sealed chamber is bubbling, that means there's a leak. Okay, unless we're doing what? When's the only time that you're going to, unless we're suctioning? Does that make sense? You guys remember that stuff? All right. There's another condition that can lead to another form of removal of something of the lungs. What's that condition called? That warrants a thoracentesis? What's it called, guys? What's going to require a thoracentesis? Pulmonary edema. That's going to require more like a chest tube. What did you say? No, Miss Na? No. Empyema is the fluid. Yeah. So pleurisy, guys. Pleural effusion. You guys remember pleural effusion? Yeah. Pleurisy is the inflammation of the pleural membrane. Okay. Then pleural effusion is when now it's infected. Now there's drainage. There's a fluid in there. It's called empyema. That requires, or that warrants, a thoracentesis, the needle aspiration. Which one? Empyema?
It's two different ones.
Yeah, let me explain them real quick.
The one in here is what? How do you say
What page are you on?
it?
429?
21.
21. 421. Oh, 421, sorry. Oh, that's emphysema. We're not there yet.
408.
408, yeah. That. Yeah, emphysema, guys, is a disease process that we're going to be discussing this week that's coming up. All right, so on page 408, go to page 407 first. First you have pleurisy, okay? It's inflamed. Okay, think of, there's just inflammation going on. It's a little bit swollen, it's irritated, that pleural membrane, with pleurisy on page 407. If it gets bad enough, it can develop into something called pleural effusion. It will now have empyema. Empyema is the fluid. Now there's pus. Does that make sense?
Yes.
So it goes from pleurisy to empyema, also known as pleural effusion. Okay? Now that's going to warrant or demand or request the need for a thoracentesis because there's fluid in there. We go into the pleural cavity and we actually aspirate. Now how much fluid do we aspirate?
1300.
Okay, no more. 13 to 1500 is usually the max, okay?
30 minutes.
Okay, and 30-minute span. At what time, now let's go back to chest tubes. When do we actually remove the chest tube?
When the patient feels relieved.
Okay, that's good. What else? When the lung is expanded. When the patient's relieved, that means they breathe better because the lung has now expanded again. Does that make sense? Okay. Have up any blow your nose? You're gonna have to wait, okay? Just swallow it, okay? Yummy? Good job. Alright, where was it? Any questions on thoracentesis, pleural effusion? What lab tests are you going to be assessing for when somebody has pleural effusion to see if they have an infection? Yeah, CBC. They don't change, guys. The diagnostics tests, whether if it's an infection of my toe, the diagnostics tests don't change. And that's what I want you guys to remember. Not, don't memorize questions, don't memorize answers, memorize concepts. That's the only way you really get this stuff, okay? All right. If my empyema my pleural effusion got so bad that my tissue necrosed and it died, and I have a lobectomy, what does that mean? Okay. Removal of a lobe of the lung. That's a lobectomy. Okay. If I say a pneumonectomy, that's removal of the lung, of the whole lung. Please know the difference between your lobectomies and pneumonectomies. How many lobectomies can we have in total of the right side of the lungs?
Just one.
Huh?
Just one.
Lobectomies. How many lobectomies can we have? 3. Yeah. Tricky question. Yeah. What I'm saying is there's 3 lobes, so we can have 3 lobectomies. Yeah. Okay.
So we can take out 3 lobes?
Yeah. Let's say this year. Let's say.
The whole lung.
Well, because there's 3 lobes, is what I'm trying to say. Let's say the whole 3rd lobe on the top is affected, so I'm going to go ahead and remove it. And then, like in 5 years later, the middle lobe gets affected, then we'll remove the 3rd lobe. And then 5 years later, your boyfriend stabs you in the chest, and now you have to remove the 3rd lobe. Does that make sense? I'm trying to get at that there's 3 lobes. But if you guys know that there's 3 lobes, it doesn't matter how I ask it, you guys will yield an answer. All right. Yes.
I still have a question. If you take out one lobe, you can alive?
That's right. Yeah, you can live. Yeah, your body accommodates in various ways. There's something called collateral circulation. You guys remember that? Okay. Collateral circulation is when your body branches out new blood pathways to Papa. Okay? Like in your coronary arteries, if it clogged, it's not giving enough blood to the tissue. You have collateral circulation, it'll build new blood vessels. So the lungs, it's a little similar to that as well. And your body will actually acclimate, it will accommodate itself. Okay, it'll put more oxygen on the red blood cells. Your hemoglobin will become a little more dense, things like that. So yeah, you can even survive with a pneumonectomy. Pretty neat, right? Remember how with the kidneys you can survive with only half of a kidney?
Over here in India, no.
You can't live like that?
I don't know. I'm asking to you. My
Oh.
mom got the. Now I forgot the disease, but she got the lung disease and
Okay, if she has a lung disease, if she has lung cancer, think something like,
it's not the cancer.
or emphysema.
No, it's a autoimmune disease. I forgot the name.
Okay,
I will let you know.
let me know. Let me know. I'll Google it and then I'll tell you and pretend like I knew the whole time. All right, let's move on, guys. So pleural effusion, guys, will require a thoracentesis. Okay. All right. What happens if you come to the hospital today and then you're looking at your patient and he suddenly looks good, right? And then you come back 5 minutes later and now he's like, I can't breathe, I can't breathe. He's coughing up frothy sputum, red frothy sputum. You suspect a pulmonary embolism. You suspect it. That's you've done your assessment. Now you're like, this is a PE. What's the first thing you do? Oxygen and what else? In conjunction with that, while you're getting the oxygen, you yell for help. Okay, yell for help because this is a medical emergency. Make sense?
So that's the answer. Yeah, for help.
Well, that's a concept that I want you guys to understand.
No, I'm saying, because I was saying venous return, but
What were you gonna say?
venous return, the legs, you don't want to lift them up or anything?
You're thinking of a blood clot. It's too late for that. Okay, but that's good though. You're thinking about that. It's too late. It already went to the lungs. So it's a medical emergency. This is my thing. The first thing you want to do is you want to let a medical professional know, like the doctor, right? But the reason why I say you want to give oxygen, call for help, because when I say call the physician, this is what it means. Hi, doc. Can you page doctor for me, please? That's calling the doctor. So we need an immediate response. So you give oxygen, you yell for help, you let somebody know, so we can call a code. Okay, give fibrinolytic medications to dissolve the clot, stuff like that. Okay, but that's a concept that I want you guys to understand. Papa, please no mas. Right on the board, Papa. Right on the board. Okay, write bad words if you want. I'll let you. What is an amniocentesis? Do you guys know?
Lobes.
Come on, those of you that have kids. Miss Na, do you have kids? Okay. So see, you're okay. Okay, the rest of you I think have kids for the most part. What's an amniocentesis? You have kids, Miss Eva?
Yeah.
What's an amniocentesis? Oh yeah, yeah, that's right. From the amniotic fluid. Okay, a withdrawal from the amniotic fluid to examine it. Okay.
Well, we didn't get that.
No, I know, but still, you should know what that is. I mean, come on, you guys are women, you know, you guys are mothers. Because at any time, if you're older, if you have certain predispositions, they tell you, you can waive the chance to have an amniocentesis. So, Papa, no, that's not yours. Okay, yeah, write some more. All right.
Why you asking that?
Why do you think I ask you that? So you could know what it is. That's all.
Oh.
Have you guys ever taken one of my tests, guys, and you notice that one of the options is something like that we haven't even discussed, that's not even in the book probably, but you don't know what it is, and you're like, oh my God, maybe it's that. Okay, that's what I'm telling you. Okay. Amniocentesis. Amniocentesis.
It is fluid.
How do you write that?
A-M, Papa. He doesn't know how to write. A-M-N-I-O. A-M-N-I-O-C-E-N-T-E-S-I-S. E-N-T-E-S-I-S. Yes, ma'am.
That is a interstitial lung disease.
She had interstitial lung disease for your mom? Yeah, that's a little bit different because what's going to happen is the fluid shift changes in your mother's lungs. So her ability to breathe altogether is not adequate. That's a little different from what the diseases that we're talking about.
We cannot change the lung.
Oh, do a lung transplant? Is that what you're asking me? Yeah, we can do that as well. Yeah, a lot of times your body, rejects it, yeah. Please make sure you guys know what acute respiratory distress syndrome is, or ARDS, and know what causes it. Don't touch my face. Hold on, here. Go play down there. Know what ARDS is, acute respiratory distress syndrome, and know what causes it. Okay? What's the purpose of, first of all, how do we assess to see if a patient has been exposed to TB? Yeah, a TB test. The skin test, right?
Yes.
What's a fast, effective way to do it? What's a really fast way to do it?
X-ray.
The one that was on the board. I'm not even going to talk to you guys about it. Yeah. Okay, please. And the reason, I'm not even going to talk about it, but yeah, know what that is. Okay, back to the regular stuff. How do we know that a PPD or a skin test is positive? How do we know it's... No, guys. How do we know a PPD skin tuberculin test is positive? What's hard? I know. What's the word?
It's more than 10 inches.
No, it's more than 10 centimeters typically. Millimeters. Indurated, guys. Induration. Please know induration. Make sure you know it's indurated. Okay? Indurated. 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 Come on. Alright, Papa, stop touching here, okay? Go over there and play. What's the whole purpose of the Candida Albicans skin test? Did you guys study at all?
No, I was so sick, so I couldn't.
She was so sick. Listen, guys, please study. Because the stuff that I'm covering right now, literally almost 100% of it, I think, is stuff that we did group work in. Like that's what it was. You know what I mean? I'm trying to help you guys out. You guys aren't studying. I won't have tutoring if that's the case. I'll just do it one-on-one again. Make sure you guys study. The whole purpose, guys, of the Candida albicans test is it serves as a control test. Yes.
In case you're allergic to the TB?
No. Well, no. Sometimes that proves a false positive. Okay, but the whole purpose of this Candida test is going to eliminate the chance of of it being an allergic reaction. So it provides a control. It's a little complicated to understand, but just understand that it provides as a control test. Okay. What's a bronchoscopy?
Take out the tissue from the
No, that's one of the things that it can do, that we can do. What's a bronchoscopy?
to view the inside.
That's right. The view the inside of the bronchus, of the lungs. Okay. Excuse me. Oh, okay, here's another one. Something good. Manda, papa. Chocolate, papa. You want some? Okay. Espérate, okay? Espérate. What's the purpose of radiation, guys? Reduce the tumor, reduce the size, reduce the reproduction of